video is we're going to do a 2-minute drill. 3, 2, 1. You're done. What you have just done, most of you have probably burned about 10 to 15 calories. So those of you who picked up the little Snickers bar, that Snickers bar is 42 calories. So if we kept going for another 8 minutes, you would have burned off that Snickers bar. Now I see some people with Subway sandwiches. Subway's a good choice. Take a look. A Subway 6-inch Subway Club with no mayo, no cheese, just ham, wheat bread, 400 calories. Now you add the cheese and everything else, and then you just keep ramping it up. The baked Lay's that always attends the side of the Subway sandwich is 130 calories. If you ate a McDonald's cheeseburger, that's 300 calories with everything on it. But it always has medium fries to go along with it. Medium fries is 500 calories. But here's the thing that kind of throws this off. All the calories from the McDonald's cheeseburger comes from fat and heavy cholesterol, cheese, and that sort of stuff. The Subway sandwich does not. The Subway sandwich actually helps you out because the wheat bread, your stomach has to process it. So it gnaws on that wheat bread for quite a while, so you're burning calories constantly. And now you guys can eat. I'll go into this more stuff right quick. Once again, like Bill mentioned, my name is Torres. Everybody calls me Mars, like the planet. I'm a 2008 graduate. I hold a degree in kinesiology, exercise science. So what is fitness? According to Webster's, fitness is the quality or state of being fit. What does being fit mean? It means you got to be fit and sound, physically and mentally. And that's when it comes to wellness as well. It's not only your body, it's everything. It's health. Being healthy. There's key components to being fit. There's an aerobic aspect, that's cardiovascular wise. General overall strength, that's the gun show. And flexibility is able to undo that gun show. The things that we end up losing the fastest is flexibility and strength as we get older. But you can combat that by exercise. ACSM, which is the American College of Sports Medicine, recommends that you do 20 to 30 minutes 3 times per week to begin with. That's just to start off. So if you're already exercising, you should be doing it 6 times a week, at least, for an hour each day. You have to increase slowly if you haven't started yet. So if you're starting at the ground level, start at 20 to 30 minutes per day, 3 times a week. It's very simple to do. General and overall strength. What you're looking for is some sort of weight training. Especially if you're a female, it helps combat osteoporosis and that sort of thing. Focus on your large muscles first. Large muscles are your big quad, your quads, your legs, and your chest and your shoulder. Those are two of the main focuses when you do strength training. Is if you keep those muscles nice and strong, your knees will last longer and your shoulders will last longer. First 2 joints that always go out. Flexibility, light stretching, and what I mean by light stretching is just no bouncing, is always kind of important. You did this 2-minute little warm-up, that should be enough to get your body moving and warm. You don't want to stretch on a cold body. Here's some yoga exercises that I saw on campus a couple of times. There's the actual yoga instructor, and there's the student over here on this side. There's a yoga instructor, and there's a student over there. And this is my favorite. I think he's still out there. He's pretty straight. Now, since you guys have a lot more influence on students and that sort of thing, this should be taught more so to students, and it should be pushed by health professionals. Physical activity is a fast-growing public health problem in this country and contributes to a variety of chronic diseases and health complications. Chronic diseases and health complications include obesity, coronary artery disease, diabetes, high blood pressure, cancer, depression, anxiety, arthritis, and osteoporosis. So when's the last time you went to the doctor and the doctor asked you, how much do you exercise? That should be a question that every doctor should be asking their patients. And if it's not the doctor, it should be a nurse. If it's not a nurse, it should be someone else in that healthcare field. So, what's the biggest thing that most people say that they don't like about exercise? I kind of heard it a little bit just a while ago in conversation with folks. You don't have time. I don't have time. I don't have time. Well, this is is my favorite cartoon when it comes to time. It says, what fits your busy schedule better? Exercising 1 hour a day or being dead 24 hours a day? That holds true. You really have to dedicate yourself and make time for exercise. Exercise is a medication, and everybody should take this medication. The past president of ACSM, is a medical doctor, as a cardiologist. He had this statement that he put out in 2007 when they started exercise as medications. If we had a pill that conferred with all the proven health benefits of exercise, physicians would prescribe it to every patient, and our healthcare system would find a way to make sure every patient had access to this wonderful drug. And that is true. I've actually seen this firsthand. I worked in cardiac rehab. For people you think that have had heart attacks or a stroke or some sort of cardiovascular event, or you think of an older person, an overweight person, somebody that has comorbidities to go along with it. Not true. I've had a younger person in their mid-30s have a heart attack, have open heart surgery. He had that, you think his parents were on. But he didn't live the lifestyle that he could have avoided that. He ate cheeseburgers, he ate really bad, didn't exercise. He was ex-military. He said, well, I exercised when I was younger. That doesn't help if, past the age of 25 to 35, 10 years of bad living catch up to you. I've had folks that had their first cardio event when they're 80. But they lived a healthy lifestyle all that time. And their quality of life, you could tell. They were up, they were moving, they didn't have somebody clean up after them. And then I've also had a lot of the 40-year-olds and 50-year-olds. It's a wake call. That's what you should think about whenever you're exercising now. Is you're making yourself more livable when you get in the 70s and 80s versus being at a nursery. Here's a fun fact. With every pound of fat that your body has, it has to grow 7 miles of blood vessels. Now you imagine that. 1 pound of fat, 7 miles of blood vessels. Your heart is about the size of your fist. Your heart works every day, 24 hours a day, non-stop. You put 7 miles of blood vessels, it has to pump just that much harder. So, looking at that sign there, I'm sure some of you guys have seen it in San Antonio. 169 miles, that's 24 pounds of fat. That's how many miles of blood vessels your body has to do if you're 24 pounds overweight. Or you can go to comfort and, it's only 1 mile. Some people think exercise is scary. And it is at first. If you've never exercised, it is scary. Some of you have that anxiety feeling when I told you to stand up. You did that, I don't want to do this. But you just got to start slow. Starting slow is the key to exercise. If you make yourself, if you do the diet, you exercise, I'm not going to drink sodas anymore, this and that, and this, New Year's resolution. No person has that willpower. You do not have that. Start slow. Start with 1 soda. If you drink 3 sodas a day, say, okay, I'm just going to drink 1 soda a day. And cut down from there. You just start slow, make it a habit, and you'll stick with it. In order to start, exercising your muscles to keep them and keep you toned, incorporate some circuit training. Circuit training is doing exercises like 3 in a row and then starting over from that same 3 in a row. And I wanted to show you guys a couple. Let me go through some of this stuff. Focus on daily activities. What do you do every day? Think about it. What do you do every day that will bother you when you get older? That is one of the key things that you'll see whenever you deal with elderly folks. That simple motion right there, standing up. Let alone if someone does this. Try to find somebody who is really elderly, has a bad lifestyle. Try to do that. That is difficult for somebody who has bad knees because they're 30 pounds overweight, they haven't exercised, they don't walk, they don't do anything. Just sit at home and watch TV. It's difficult to stand up. Those are the things you need to focus on. Those are your large muscles. So I wanted to show you guys a couple of exercises that you can do with a simple towel. This towel will turn into about 200 pounds. What you'll do is you'll take this towel like so. The first exercise is the hardest exercise. You can do it with weights or you can do it with a towel. You'll take the towel and you pull it as hard as you tight as you can. Bring it across your chest. Widen out your stance. Drop down to a comfortable level. Squatting, to a 90-degree angle is the best way. Work elbows and knees. But if you can't get there, that's fine. It's flexibility. You don't have it, or you're kind of nervous. If you need to, you can sit next to a chair in case you can't get back up. All right. So what you do is you'll drop down, and then you'll just come straight up with the towel. And repeat the motion. What you're working is your shoulders, your biceps, your quads, your hamstrings. If you want, pick up on those toes, your calves, your abs, your back. Every muscle is used. With this 5-pound dumbbell, same thing. Just drop down, and then you'll come straight up. Using this towel, your shoulders are the least worked muscle, and they always get injured. I see more people with shoulder injuries and knee injuries than anyone else. Shoulders, all you have to do is just pat the towel like this, pull it nice and tight, raise up the shoulder level, drop back down. 10. All you gotta do is 10. Once you get to this point, raise up and over, and then back down. Then you just grab it, and then you can go down the other side. Lunges. Lunges are wonderful, but they have to be performed correctly. You can use the towel as well. Both feet together, take a lunge forward, push the arms all the way out, and come back. If you notice that my knee does not go past my toes, and you can actually see my toes. With those simple exercises, you should be able to, then you'll work up and move on, and then you'll get bored with that at home. Buy some workout DVDs. You can always join a gym. Gyms are kind of that, I don't really feel comfortable here. Well, find a trainer, hire them for 6 sessions, tell them, hey, this is what I want, give me something consistent. And a trainer should be able to show you specific exercises that can help you. And all in all, have fun with them. Always have fun. Here's 10 reasons to exercise. Exercise relieves depression. When it does that, there's neurotransmitters that are released when you exercise, and they help you cope with depression. Improves mental sharpness. Your brain works off of carbohydrates. There's nothing else your brain uses, just carbohydrates. Well, once you exercise, you start metabolizing those carbohydrates a little bit better. The machine runs better. Your brain runs better. Can relieve stress and anxiety. Hey, this is, for those of us runners that are in the room, that is the biggest thing that I use for. I mean, if I am stressed out to the max, I'll go do, 8-mile run, and I feel so much better right after. Prevent certain types of cancers. There's a lot of research going on right now on which cancers it actually affects, and it actually helps out all of them. But the proven research that has been done is on colon cancer, breast cancer, I believe it's pancreas. It improves your quality of life. It does so just because you feel better, you move better. When you get later on in your years and you haven't used the muscle, if you've ever heard the saying, use it or lose it, you will lose it. You don't exercise. So it improves your quality of life later on down the road. Reduces your risk of heart disease. Your heart has to work less. Remember the whole 7 miles per pound. Increases your good cholesterol. It just makes your engine run better. It smooths out your blood vessels. It improves your quality of sleep. You're tired from exercising and you sleep better. It actually helps out for what it does, relieves depression. The body releases neurotransmitters that help you sleep. It slows the process of aging. That's pretty easy. The whole waving, the Oprah wave, whatever she used to say. If you keep your muscles tight and you exercise, it'll help that process of not aging so much. But here's a tidbit for you, if you ever run into that again. Just tighten up your arm and give the wave like the beauty pageant. That's everybody who waves like this, your tricep flat. And it enhances your self-image.